Your doctor has checked your blood pressure, they checked your blood cholesterol, they checked your blood sugar. Nobody checked your liver. And if you have a fatty liver disease, which 1 in 3 people in India do, that may be one of the most consequential things nobody ever told you. Because here is what the research now shows clearly. The number one cause of death in people with fatty liver disease is not liver failure, not cirrhosis, not liver cancer. It is stroke and heart attack. Stay with me, because what I am about to explain changes how you think about your liver forever. Most people think of liver as a filter, something that processes alcohol and toxins. You are told to protect it mainly if you drink. That is far too small a picture. Your liver is the command center of your metabolism. It controls your blood cholesterol. It produces proteins that determines whether your blood clots or flows freely. It regulates inflammation throughout your entire body. It determines how much fat travels in your bloodstream at any given moment. When the liver is healthy, all of these systems are in balance. When the liver is diseased, when it is drowning in fat, every single one of these systems go wrong at the same time. Let me walk you through exactly how a fatty liver causes a stroke. There are 3 mechanisms, and all the 3 mechanisms can happen simultaneously. First is inflammation. A liver full of fat does not sit quietly. It releases inflammatory chemicals called cytokines directly into your bloodstream. These chemicals attack the walls of your arteries, causing damage and triggering the immune system to respond. The artery walls thicken and harden. Cholesterol deposits in your arteries. The same process that blocks a heart artery and causes a heart attack is also happening in the arteries that feed your brain. Second is dyslipidemia, abnormal blood fats. A diseased liver loses its ability to properly regulate cholesterol and triglycerides. It pushes too much of the wrong kind of fat into your bloodstream. LDL rises, HDL drops, triglycerides climb. This is a direct recipe for accelerated block formation inside your arteries. The plaque that breaks off and causes a stroke, just like heart attack. Third, this one surprises people, is coagulation. Your liver produces the proteins that keep your blood's clotting system in balance. Both the proteins that cause clotting and the proteins that prevent excessive clotting. When fat accumulates in the liver, this balance tips off. The natural anticoagulant proteins drop. Blood becomes more prone to forming dangerous clots. And a clot that forms in an artery supplying the brain, that's a stroke. The 3 separate mechanisms, all 3 pointing at the brain. Now let me give you a number that every person with fatty liver needs to hear. A large number of research studies involving over 17 million people found that fatty liver disease is associated with a 60% higher risk of ischemic stroke compared to normal people. Not 10%, not 20%, 60%. And for atrial fibrillation, an irregular heart rhythm, that is one of the most common cause of stroke, the risk is 70% higher in people with fatty liver. These are not small numbers. These are numbers that should be on the front page of every health report. Here is what makes this so dangerous. Fatty liver disease produces no symptoms, no pain, no jaundice, no warning. You feel completely fine. And while you feel fine, your liver is quietly flooding your bloodstream with inflammatory signals, pushing your cholesterol out of balance and making your blood more prone for clotting. By the time a stroke happens, the damage has been building for years, often more than a decade. I have seen this in my own patients. People who come to me after a stroke, and when we go back through their history, they had a fatty liver ultrasound report sitting in a drawer. Elevated liver enzymes on a blood test for 3 years ago. A triglyceride level that was high for years. Every one of these was a signal. None of them were connected. Nobody said your liver is putting your brain at risk. So what do you do with this information? First, get tested. If you have never had a liver ultrasound, get one. If you have had one and it showed fatty liver changes, take it seriously. If your last blood test showed elevated ALT, AST and triglycerides, those are the liver signals. Do not ignore them. Second, understand that treating fatty liver is treating your stroke risk. Every intervention that reduces liver fat, reducing sugar and refined carbohydrates, intermittent fasting, regular physical activity is simultaneously reducing the inflammation in your arteries, improving your cholesterol profile, reducing your clotting tendency. You are not just protecting your liver, you are protecting your heart and brain. Third, if you already have other stroke risk factors like high blood pressure, diabetes, or a family history of stroke, and you also have fatty liver, your risk is not additive, it is multiplicative. You need to be working with a prevention specialist who is looking at the full picture. The connection between your liver and brain is real, it is documented, it is measurable, and is almost never talked about. Your cardiologist is watching your heart, your neurologist is watching your brain. In most cases, nobody is watching your liver, and yet your liver may be the reason both of these organs are under threat. This is why I made this video, not to frighten you, but because understanding this connection is the difference between reacting to a stroke after it happens and preventing it from ever happening at all. I am Dr. Harsha, stroke, lifestyle and prevention expert. If you want to understand the other hidden conditions that rise your stroke risk, conditions that standard checkups miss, watch this next.